hostess, Venetia.
Hey, you guys.
Venetia,
Praying all is well.
Venetia, you want to start off with scripture, please?
Since you put me on the spot, yeah, why not? Let me see. I'm gonna come from Ephesians 3:20. With God's power working in us, God can do much, much, much more than any of us can do or imagine.
Okay, I have a scripture also. God is our refuge and our strength, an ever present help in trouble. Psalm 46, verse 1. And the last couple of weeks, we've basically been talking about the effects of addiction and doctors. And there is a small part that I'm going to read from the Celebrate Recovery Bible, and it talks about sanity. To begin to stop making the same poor choices again and again. And that's part of the cycle of addiction that you keep, or as they used to say back in the day in the halls, insanity is repeating the same thing over and over again and thinking that you're going to get different results. And I looked up the definition of addiction, and it says the fact or condition of being addicted to a particular substance, thing, or activity. And the synonym was dependency, habit, or problem. And then I went to the DSM-5, and that's the Diagnostic and Statistical Manual of Mental Disorders, because substance abuse is considered a mental disorder. But nowadays, they don't call it substance abuse. They call it substance disorder. And they no longer call relapse that. They call it recourse. And I personally have a issue with those labels. Disorder, a state of confusion, cinnamon, disarray, chaos, confusion. Another definition, disrupt the systemic functioning or neat arrangement of something. And I was like, to me personally, you're giving people an excuse to continue with their addiction because you're almost saying it's not their fault. And Venetia and I both know that it may not be your fault, but you have a choice. You don't have to stay stuck in that mode. And according to the DSM-5, it's an abnormal physical or mental condition or ailment, and that it disrupts normal physical or mental functioning. So that is the current terminology of the doctors and the clinicians that they're using now. And again, this is my personal opinion, I feel it's like blaming the victim. Oh, you have an issue or a problem and you can't help it. Like you don't have any strength to overcome it or fight it. And we know with God, all things are possible. Venetia.
I just want to say something about that. And here I go again with the discrimination. There's discrimination in regards to that as well. If my skin is not of this color, brown, for those that can't see, you basically can probably get anything you want. And I mean, I know that they've been getting harder on the doctors, and the doctors are making decisions, but it still exists. It still exists. If you have the same diagnosis, you have the same, problems with chronic illnesses. That's because there's a big difference. They done made it from chronic being long term, that means you're never going to heal. It's just going to get worse and worse and worse as you get older, to acute. So now the new word is acute. And acute is that you basically you're going to die. You know what I mean? So you'll be in so much pain, you're going to end up dying. So that's the new, that's how my doctor explained it to me, both of them, because I was fighting them. Because all through my records, it shows, Boston Medical, Beth Israel, Beckham and Women's, Roxcom, they all show, chronic illness. I have a chronic illness. And they were saying, well, that's not bad enough. You have to be acute. So that's another one that they have added on to to our to our I guess I want to say to the DS, whatever you call DSM-5. And it's sad because if you have the same ailment and you have the same pain, if you're not the same color, you're not going to get the same help, you know. And that's what happens. And Leslie's right, you know. We know through all things God can, will heal us. You just got to believe. You have to believe, my couple of weeks, my week has been hell, and my medication, because of the, I guess I didn't know that carpal tunnel running in your shoulder as well, and so they're not giving me anything for the fibromyalgia. They said that fibromyalgia, you have to take Percocets, 10 milligrams on up, and all that, and I don't want to do that. I don't want to be on the radio. I don't want to be on the show drooling and dropping, and so they had lowered my dosage. Because my dosage, I'm feeling the lowest of my dosage, so I find myself taking more. You know what I'm saying? And because of it, it's the addiction, because it's causing me to want more, because they have to decrease what I was on. In January, I was on 114 pills every 2 weeks. By March, I was on 90. And so they keep decreasing. And what's happening, I'm looking, my body's saying, what's going on? And so my body is actually going through withdrawal, and because of it, I can feel it. I've been staying with Leslie. I know she's seen it. You know what I'm saying? And it's a shame, but that's what it is. And so I have to see my doctor in 2 more weeks. So I have to talk to him about that, because I'm seeing this happening to me, and it's only supposed to be happening to me with Percocets or Xanax, or any of those pills that's out there, not the ones I'm on. So I have to talk to him about why is this happening? Why is this all of a sudden I'm nodding out like that and things like that? And I know a part of it might be because of the combination of the medication that I am on. I'm on a lot of medication that makes you sleep, or makes you go out or something like that. I know one of the sisters said to me last night, it's not funny, but in the way she said it was true. She said, Sister Nish, everybody knows when you're in pain, because we could tell because you're on your medication, But, they know, you know what I'm saying? And I totally agree with what Leslie said, but I'm relating because I'm a witness, and I know that's something that I'm still going through.
To piggyback on what Venetia said, and we kind of talked about it last week or the week before, that doctors prescribe medication and they don't fully explain the side effects.
Nope.
You know, we do have some weight in that because a lot of times, oh, my doctor said, and we go from there. And there used to be a commercial on TV, and this person was just chatty, chatty, chatty. And then when they got to the doctor's office, the doctor said, "Do you have any questions?" And they're like, "No." Don't give your doctor that power.
Amen.
You know, you have to advocate for yourself. And if you don't ask questions, they're not going to tell you.
That's right.
And you know, and I think I said it then, and I will say it again. They get their diagnosis from you. You tell them, "I'm feeling X, Y, Z. This hurts, that hurts. I'm not sleeping. This isn't working." And then they come up with the diagnosis, and then they look up in their little book or on their computer, and then they tell you what medications cover those symptoms.
Yep.
But the second piece to that is that you need to ask them, is there a side effect? And if you watch the commercials that are on TV now, they might say, "Oh, I have fibromyalgia. Take Lyrica." And it shows the little dots of the body. And then in a lower voice, might cause suicidal ideation, might cause irregular, heartbeat or
Don't
whatever.
forget the liver. Don't forget the liver.
Whatever the side effect is,
Yeah.
they say it in a different tone.
Yeah.
So when they're talking about the medication, it's all excited.
Yeah.
But then when they talk about the side effects, it's in a lower tone and almost a monotone voice. So if you're not listening or paying attention, you might not pick up on that. Your brain is going to, your brain and your ear gate's going to hear that first piece. Oh, this will cure this, and I'm going to go get it. But you have, advocate for yourself. Do your own research, and again, ask the doctor questions. I have seen, and I know Nish has too, I have seen too many people that have been, and I'm using the word, have been in recovery, and they came out of it because they were in a car accident or they had a slip and fall. They had something where they injured themselves, and the doctor's prescription was for a pain pill. And they did not question it. And one of the things, and we discussed this before, your brain doesn't know the difference between a Percocet, Xanax, or a hit of crack or coke. It just knows, there's that feeling. I've been missing it. I've been looking for it. And then you're back. You're off to the races. And it's a lock and key theory. Your brain is looking for the key. The synapse is empty, so it's looking for something to fill it, because you've disrupted the brain pattern by taking the drugs and the alcohol. So now it's like, Pac-Man, feed me, and it's looking for something. So when you take the drugs, that fills that gap.
Right.
And then when you come off the drugs, your brain is saying, hey, what's going on? I'm hurting, I'm in pain, I'm looking for something. And then you start that cycle again.
Right.
And they don't fully explain that to us, that once you've kind of destroyed that connection in the brain, it doesn't really regenerate itself back. So you have to ask them, how is this going to affect me?
Say that again, Leslie. Say the part again about how they do not explain about the cycle, about how when your body is actually saying what's going on what's going on with the medication. That is so important, because that right there, what she just said, that leads to relapse. It's by the grace of God that I'm not running up and down the street right here on Washington Street trying to get me a trick so I can go get me some heroin. I don't even want the crap. Just give me some heroin, because I know heroin, you will medicate me.
Take it all
You
away.
take it all away, take it away, and it's also, we know that, it has, medicine. I can't say the word because it's stupid Bell's palsy. It has a medication. It's medicated. There's a medication in it. So yeah, you rationalize, I'm taking it for medication, but you're actually taking it to get high, and that's what Satan wants. You know, he wants that. He wants to get you back out there. So he'll have you rationalize and justify. What she just said is so important. It's so important. And they don't talk about that. They don't say those things. They only talk about it if you ask them. If you ask them, you know. And my doctor, I really have a really good doctor. Sometimes I can't stand him, and that's only because he tells me the truth. You know what I'm saying? That's only because I can't get over on him. This, you know, I'm just being real honest with you, and he tells the truth and he lays it out on, you know, hey, this is what's going on. I'm trying to tell you, Venetia, I don't know who put this on you, but they should have never gave you this because this does not work for fibromyalgia. And then he tried to give what Leslie just said, the Lyrica. And then I said I can't take the Lyrica because of my liver. You know, I have to be careful of my liver. You know, so that's another issue. Some of these medications that she's talking about, ooh, you know, it affects your liver. You know, and you may not have a problem with your liver whatsoever, but once you're on those medications and you start taking them, you may have an issue with your liver down the road. Uh, I'm done.
Again, you know, this speaks to advocating for yourself and asking questions. One of the things that we basically learned was right, make a list. Go in your doctor's office with the list. You know, I need, you know, does it do this, does it do that, what's the ingredients? Just like back in the early days of recovery, we were taught how to read labels because there was alcohol basically in everything. And you know, I know you all, depending on what generation you are, might remember Kitty Dukakis. She was drinking Listerine. That's how bad she wanted alcohol. And we got taught early on, read the labels because there's alcohol in something as simple as toothpaste. And if you are really addicted and real sensitive, you pick that up. And if you're a good fiend, you want the real thing. You don't want a half step. You know, so you have to put that protection around yourself. So, you know, you need to read labels. You need to ask the doctor questions. And remember that they are not God. They go by the information that you tell them. And the financial piece to that basically is they get paid to sell or prescribe certain medications. You'll see the pharmacy reps going in the hospital and in the clinics and stuff, you know, pushing the latest pill or wonder drug, you know, and you have to be prepared and know what's going on. Because if you don't, you'll, you know, the old expression, if you don't know, you'll fall for anything. So you have to protect yourself and ask those questions. And they might seem like loaded questions to your doctor or an insult to his intelligence or his authority. Too bad. This is your life. This is your body. And you need to know what is going to happen when you put this substance in it. Because just going straight, anything you put in your body, you know it has an effect. So why would medications be any different? So, you know, if you have to keep it that simple, keep it that simple. For everything you do, there is an action. You know, that's the recourse. You know, I know, for example, I love Coca-Cola. Everybody that know me know that. If I drink too much Coca-Cola, guess what? My feet are swollen up like balloons and I can't get my shoes on. I got to wear a bigger size. And I know that. So I have to monitor my use of Coca-Cola because if I don't and I go hog wild and crazy because I can and I have craved that, I'm the one who pays for it. Physically, I get uncomfortable. So you need to have that kind of attitude. Okay, if I take this substance, I take this medication, you know, what's going to happen to me? You know, and you need to ask your doctor and don't be afraid. Especially in our community, we really need to advocate for ourselves because, you know, as Nish said, if we don't ask, you know, it's almost like being in the army. Don't ask, we won't tell.
Ooh, you know something? you would be amazed how many people in our community that they're pushing these pills on. It's unbelievable. Sometimes you go into the pharmacy. I like to go early in the morning, as soon as they open up at 9 o'clock, because anytime after 9:30, that line is going outside the door. And it's not just where I go. You know what I'm saying? It's Walgreens. And I have to get the heads up. I mean, a salute to Walgreens on Warren Street, because they do what they have to do. They get that medicine in and they get that medicine out. You don't have to be in a line like they was like 4 and 5 years ago. That was ridiculous. And I know a lot of it came from Roxcont. They was getting a lot of the Roxcont patients once they closed down the pharmacy over there. And you have to excuse me, my arm is killing me. And so a lot of the patients were coming there, but now they're really quickly. But I'm trying to tell you, I just watch and I just look, and I'm like astounded. And then I go back to, me. Leslie was watching a series last night. I said, this is my show. It's about the future, and that's where I was at, sitting there zoned out, looking at this stuff, saying, this is how we're going to be for in the future. Everything's going to be on a pill. Everything's going to be on a pill. You're going to have to go and sign up. You're going to have to sign in for this pill. You got to sign in for that pill, And it's just sad that the fact that listen, let me tell you something. It's worse than Boston Medical. Now, that can't be nobody. You can't be no worse than Boston Medical. No, for real, And everybody know about how bad Boston Medical can be, as far as the pharmacy is concerned. I cannot do that pharmacy down here. I think I'll have a PTSD attack, because it's just crazy down there, and it's no order, and people talking to you any old type of way, and nothing against anybody with mental health issues, because God knows Renisha has them. Clinical depression, yes I do. PTSD, yes I do. You know what I'm saying? It's just that you feel like you're being attacked, and you got to be careful what you're saying, so I choose not to go there, because I don't want to put myself in that position. But just to actually watch that and see that, it saddens me, because a lot of it is our people. It's a lot of us are our people. Something. This is scripture. And I said, I don't know why I'm writing this, because I don't really understand what the scripture means. And then, as Leslie was talking, it revealed to me what it meant. And it's Ezekiel 36, verse 25 to 26. I will sprinkle clean water on you, and you shall be clean. I will cleanse you from all filthiness and from all your idols. Remember, Leslie used to talk about, she always talked about the idols? Pills are idols. I will give you a heart and put on a new spirit within. You will take the heart of stone, my God. You will take the heart of stone out. You take the heart of stone out of you, and I'll give you a heart of flesh. And that's what's wrong with the world. I don't care what nobody say. I don't care how it looks. It's a bitter heart. It's a heart of stone. I know sometimes I can be I can't say a little emotional because you can't be a little pregnant, but I can be emotional at times. And I thank God that He got me like this, because I don't ever want to be formatted and not be who He created me to be. You know, my tears are for our people. My tears are for me. My tears are for, my children and my grandchildren and the future legacy. What am I going to leave them? What legacy? My mom left a beautiful legacy. My grandmother left a legacy of strength. My mother left a legacy of love. And she loved fiercely. I used to be jealous. I was so jealous. And I want to know, what legacy will I leave? And I pray to God that I leave a legacy of hope. Go on, us.
One of the things I want to piggyback on what you said about the idols, and you said it. We make the pill the idol.
Mm-hmm.
And more than that, we make the pill the little God.
Mm-hmm.
If I take this pill, it's going to take away everything, and I'm going to be all right. And it's okay because my doctor said it is.
Mm-hmm.
Well, what kind of power are you giving him?
Mm-hmm.
I can do all things through Christ who strengthens me. I can turn to God and ask Him to remove the pain. I can turn to God, ask Him to give me a sweet sleep if that's what I need without taking a sleeping pill. I can ask God for Him to carry the burden of the pain, which He's already done when He went to the cross, but I can ask Him again, I need you to come in right now and to show up and show out and take this from me because I can't do it. And most importantly, we've got to remember that this is the kind of stuff the devil loves. Oh, I've opened that door. She's taking medication. I've opened that door. She's acting out. I opened that door. She's feeling down, out, and depressed. She's hopeless. That's what he wants. So whenever we feel depressed, whenever we feel that we're out of order, or that hopelessness that I can't do this, or worse still, I don't want to do this, we got to look at the source. Those are the openings that the devil looks for. He ain't going to come at us when we're praise the Lord, I'm happy and I'm righteous and nothing's bothering me and God is at my side. He's going to come when we're fearful, when we're not sure that we want to do this walk or we can do this walk. That's when he's going to come in, because those are the kind of openings he looks for. And that's why he goes about roaring the way he does, because there are so many people that are out there that don't have any faith, that don't have any hope, that don't even know about the power of God and what He can do, how He can make a bad situation turn around for your good. They just feed into those feelings, and we got taught early on, feelings aren't facts. It's just a situation that you are currently going through. And there will be a resolve if you hang in there long enough, if you ask for help, if you go to somebody who you respect that at that moment might be a little stronger than you or have a little more information than you, or who is just there and doesn't want anything from you but for you to get through whatever it is you're going through. But because we have pride, sometimes we don't ask for help. Sometimes we, I think Venetia said it a couple of weeks ago, we play the martyr. Oh, me, I can't do this, or nobody's going to listen, nobody wants to help me. We play into that victim issue. And that's how people sometimes get stuck, that they give up hope. And, we used to tell people back in the day, don't give up before your miracle happens. Mm-hmm. And the bottom line is, once you stop using, that's the miracle. Mm-hmm. Staying clean, sober, in recovery, that's the work. You can stop using, but it's staying stopped. that is the work, the hard piece. And we need to do that self-talk. Remind ourselves that I'm okay. I don't need anything. I don't want anything. And if we have to do it every 5 minutes to remind ourselves that we can do without, then that's what you need to do. And there's no shame in that. The shame is that when you just think that's it. Right. And I know people, Nish knows people that this is my life. I'm an addict. Ain't going to get no better. I'm going to die an addict, or I'm going to stay a drunk, or I'm going to stay out here in the streets because this is the only life I know. And like I said earlier, that's a choice. And that's not a choice that God wants us to make. He wants us, 1, to turn to Him, 2, give Him all our focus and praise, and count on Him, not man.
Yeah.
And see, I'll say it for me. I'm old school. When we first came into the field, you didn't take anything. You came in, you came in from detox, and you came into treatment,
wow,
and you dealt with your stuff. You had people support you physically if they needed to, emotionally, socially. You didn't take any medication. And then we watched the field transform, and then it got to the point, well, which comes first, the mental health or the substance abuse?
Yeah.
And then people started coming into treatment on medication. And the bottom line was, if you wanted funding, you couldn't refuse them.
That's right.
You had to take them
That's
in.
Right.
And also at that same time frame, the system split.
Yep.
Because it was all one system,
Yep.
substance abuse and mental health.
Yep.
But when they started doing that, they caused 2 divisions. So then you had the mental health system, and then you had the Bureau of Substance Abuse. And it's still like that today. And in my opinion, that's what has caused a lot of the chaos and confusion as far as treatment. Because you have to follow the rules and regs that the administrators have laid out. And it makes it hard because you have to know some science now. You have to be a clinician. You
Yeah.
can't be a counselor anymore. You
No.
have to be a clinician.
Yeah.
And you have to stay up on top of the DSM.
Yeah.
Now we're at DSM 5. I think
Yeah.
when we started, we might have had DSM 2.
Yep.
We're talking about 20 years ago. And it keeps changing. They want us to say it's evolving.
It's not
And
evolving. It's changing.
in my opinion, I think we're kind of, in a sense, going backward because we're not treating the root cause. All right, I'm using drugs, I'm drinking, I'm screwing around. Why? I got raped, I got molested. I got told I wasn't pretty as a little girl, so I don't want to feel all that stuff. So this is what I'm going to do. I'm going to drink every night. I'm going to get high every day. I'm going to have as much sex as I can because that makes me feel good about myself, because you got to remember, you can get addicted to anything.
Right.
And that doesn't get touched. That doesn't get touched. And you have to look at
Wow.
that. You have to look at that. You can't give me a pill. Yeah, I have anxiety. I have depression. But the pill don't take that away. That stuff is still there. It might take the edge off of it, but it's still there. And the things that led me to those conditions, I have to talk about. Because if I don't talk about it, it sneaks up on me. And we got taught early on, when something's going on with you, you need to figure out what it is. And Vinish talked about it a couple of weeks ago. I know for me, I'm seasonal. The seasons affect me. When the holidays start coming, that's when I start getting depressed. That's when I start feeling less than. That's when I start feeling lonely. Yeah. That's when I start to grieve my past about things that happened to me or that didn't happen to me. And I have to take a hard look at that. It's painful and it's uncomfortable, but I have to look at it so that when things are popping up, I know why. I can no longer be ignorant and say, oh, I don't know why I'm feeling this way. I just am. I guess that's who I am. And that was my attitude, 25 years ago. Today, I know why. I know why. And we talk about those things personally, professionally. We do that. We have a circle of support around us. So when something's going on, people can just look at us and say, hey, what's up? What are you thinking? What's happening? And for some of our folks, culturally, it's hard for them to talk, because, if you grew up in the generation I grew up in, no, that stays in the house. You don't bring that outside. You don't tell anybody. Don't you dare talk about that. That's nobody's business. And, in the halls, they used to tell us, you're as sick as your secrets. There's some stuff you can't keep. You've got to let it out because your mind is like a computer. It can only take so much and then information, and then you got to let something go so you can take in more information. Otherwise, you're going to be on overload.
Yeah, absolutely. And the other piece, too, I know for me, when I went to Womanique, I wouldn't talk. I wouldn't talk because I didn't realize that I wasn't talking because of the fact that when I was a child, I came in Womanique at 31, but I think they said I was at the age of maybe 15 or 16. My age was 31, but the trauma that eventually that stopped me from growing was around 15 or 16. And I remember always talking. Always, I was a talker. And one time I remember something, and I told Leslie, and I got smacked in my mouth because I didn't know. So I asked, what did that mean? Because that person was calling my mother that name. You remember what I'm talking about,
Yep.
Leslie. And from that point on, I didn't really talk that much. And I remember her saying, from now on, like she kind of put it on me, like from now on, you stay in a child's place. And that's where I stayed. And I became passive aggressive. I just didn't speak. Things happened to me. It would just take one little thing and then I'll blow up because all the things I had not spoke about, and then finally I blew up. But she's absolutely right. In our culture, what goes on in our house stays in our house. That is a big one. And now that they have, they're not just doing the pills, but now they want to have therapy in your home. Ooh, Lord Jesus. That's a whole nother hour. Just having, people coming into your home and
Judge the way you live.
thank you. Thank you. And that's because that's what the first thing they do. In my observation, by my, that's what I see. I see them judge from how you live, and they take that in, that first impression. They don't take the time to learn who you are and to understand who you are. I remember being our case manager for Dorchester House in Cardinal Square. We was put there so the doctors could understand the patients because they didn't have no feelings, or it was like no compassion, for the patients.
Connection.
Girl, not the connection. They didn't have no passion. Here, take this, take that. And they had to. They said they had to. Put people in place at the different health centers that their patients were going to. So I forgot his name. He was the head of the AIDS program, Larry something, I forgot his name. But he was concerned that they wasn't getting no help and that there was that they had to have this Belinda done all of them. They had to have Rhoda. You know what I'm saying? They had to have all this stuff in place that was on the board, and and they did that, and it worked. It really, really worked. I mean, I started seeing the doctors change towards the patients. Because they started learning from me. Hey, so and so's going through this, and you gotta, just giving them the social issues that were going on. That's all I had to do. That was my role, to tell them socially what they were going through, and it made a huge difference. Now, let me tell you something. If they had kept that, and kept that for all the patients, what a wonderful world it would be. You understand me? What? Okay, they cut it off. They said, "Oh, they're living longer now, so we don't need, we don't need this, and we don't need that, and all that." So a lot of the funding got cut, because thank glory be to God they are living longer. But something beautiful was birthed from that, and they cut it, because it could have went across the board for all patients, not just HIV patients. And I think that was the worst thing that they could have done, because something was birthed, and it was beautiful, and people were able to talk to the doctors, and like you said, you have to empower, and that's what we did. We empowered them. You ask them this, and you ask them, what's your concern? Write it down and go in there and ask them. And excuse me, and because of the doctors were willing. That was a good question. Let me go get my book. I mean, this was awesome. It was just so beautiful to be a witness to that. And of course, whatever works, whatever works, they break it. No, for real. Whatever, and it could have been such a beautiful thing. But then it goes back to what you said about the substance abuse and the mental health piece and all that stuff, and it all they messed up. Like you said, they went backwards. They really, really did, because that's how I got labeled, and I was fighting. I was calling myself Fighting Minds, all by myself. Me and my supervisor, and she was like, "You are now labeled. You are now labeled. You are now labeled with clinical depression. You are now labeled with PTSD." I mean, they was labeling me left and right. I was like, "You can't label me like that. I'm a graduate." You know what I mean? I'm like, "I'm a graduate. You can't label me like that. That's after the fact." But the reality was, I did have PTSD and didn't know it. Until they explained to me how I got it, by being raped, and then being raped constantly at 8 years old, and didn't realize that I was suffering from post-traumatic stress disorder. So like Leslie said, a lot of it got messed up, but there was a lot too that I learned. But do I like being labeled? No, I do not. I like to be labeled Renisha Yvette Simpson. That's my name. No more, no less.
Yeah, our society has a tendency to give labels, keep labels, and hide behind labels, because it makes a nice, neat little package. I'm depressed, so that's my label. So then they look for signs under depression. Or if I look a certain way, oh, you must be in a state of depression. And maybe I don't feel like smiling. That don't mean I'm in a state of depression. Or maybe I wanted to cuss somebody out before I got in the office, and I fought that feeling, and I'm just pissed off. And that's what you're seeing on my face, not that I'm depressed. I might be a little upset or even angry, and they keep putting those labels on us. How are you feeling today? Is everything all right? and they don't want to hear a long answer. Oh, everything's fine. And see, back in the day, and I can't repeat the first part of it, but fine meant that we were messed up, insecure, neurotic, and emotional. No, I'm good. I'm okay. I'm good. Why am I going to talk about something if I know you only going to listen to me for 15 minutes and then you're going to cut me off and your phone or your pager is going off because the next client has come in and my time is up, but you're going to bill for 45 minutes to an hour, and you might only really talk to me, depending on the facility that you use, for a good 15 minutes. And that can shut somebody down because you want to talk, you're on a roll, and then you get cut off like that. And you can't do that. When you open somebody up, you have to give them time to go through that process, and you have to help them close back down, close that wound, shut back down, and make sure that before they leave your office,
Yes.
that they're okay.
Thank you.
That they're not raw,
Thank you.
that they're not still hurting or upset because of the stuff that they just talked about in a session with you. You have to, help them close that up until the next time they meet you.
Mm-hmm.
And for me, the issue that I have with that is, I'm not going to see you. Okay. And you come back in 6 weeks.
Yep.
Well, what am I supposed to do for 6 weeks? I'm holding on to garbage for 6 weeks because that's the next appointment that you can give me. Unless I have an emergency, then I can call like a hotline. But, why am I going to call a hotline and talk to somebody that I don't know from Jack?
That's how backed up they are.
I want to talk to
they are.
my doctor. And I've been lucky, by God's grace and His perfect timing, that I've had doctors who understood about substance abuse,
Right.
who understood about depression, who understood some of the cultural norms that I was expressing, and they took the time
Right.
to listen. They checked in with me first before they got to the meat of whatever
Right,
it was that I
right.
was there for.
Right.
And that was a gift. That was a blessing because I've been with doctors. They got their clipboard and they're going down the clipboard and everything seems okay. You got to watch your weight, but other than that, I think everything's all right. And I'm out the door. And again, that comes to advocating for yourself.
Yes.
I need to talk about this, or I'm feeling this. And if they're been trained in areas of sensitivity, they listen to you. They just don't rush you in, rush you out. And I understand that there's a crunch because they have to see so many patients within a time frame because they got to pay for the billing.
That's
I
right.
understand that. But don't look at me as a bill. Look at me as a person
That's
that's coming
right.
to you for some help.
That's right.
That's coming to you to, share some of what's going on with me. Burdens lessened, burdens shared are burdens lessened. So whether you want to be or not, you were part of my support system.
That's right.
And I'm telling you what I need to tell you so that I can, in a sense, get reaffirmed as to what's happening and that I won't think I'm completely crazy or off my rocker, that you understand, that you're compassionate, and you might give me a suggestion or, bottom line, I think your meds are working. Maybe we need to go to a higher dosage. Well, what do you feel about that? What do you think about that?
No.
Some doctors do that. Some
I know.
don't.
I know.
They just up it.
I know.
And once again, because of the stigmas and all that goes on with medication and with doctors and their rationalization of how they treat their patients, we could talk about this for a couple of weeks.
I know, because when Leslie was talking about something, I know we got a minute. One doctor actually told me, I'll never forget it, and I'm going to say where it happened at. I'm not going to say the doctor's name, though. It happened in the doctor's building. I was sent there for rheumatology, for fibromyalgia and rheumatology. And this doctor told me, I'll never forget it. He said, "You got too many social issues for me. I can't see you no more." Just like that. And he dismissed me and wrote a letter to my doctor and said, "You can't see me no more." And that's what we're talking about. Stuff like that. It has been a blessing, and I'm glad that we're here. I'm glad that I made it. That song that Sister Renee plays, every time she plays it, every time it goes on, it makes me grateful that I made it. You know, we are V Simpson 15 at AOL, the Boston RCL, the Boston RC at AOL. Leslie Wilson on Facebook, Benicia Simpson on Facebook. I do not know the number for our Recovery Connection line. Yes, go on, cuss me out. I'm got short-term memory loss. 857-258. I don't know the number.
8691.
Thank you. And if you want, you can always call us at 617-282-0685. And I'm quite sure Renee, Minister Hobbs, Pastor, someone will give us the message, and you will get the message. Have a great, great day. And don't forget, ask questions. You have the right. And then before you do that, go to God.